Why does it burn when you pee? Few things can be as uncomfortable and concerning as pain when you urinate. For most people, urination is such a normal, unconscious act that they never pause to think about it, until something goes wrong. The burning, stinging, or sharp pain that accompanies urination, medically referred to as dysuria, is a symptom that often causes immediate anxiety. Is it a urinary tract infection? Could it be a sexually transmitted infection? Or is it something more serious involving the bladder, kidneys, or even the prostate in men? Dysuria is not a condition in itself but a sign that something is affecting the urinary system, which includes the kidneys, ureters, bladder, and urethra. While it is one of the most common reasons people seek medical help, the causes can vary widely depending on factors such as age, gender, sexual activity, underlying health conditions, and lifestyle. For women, dysuria is most frequently associated with urinary tract infections, while for men, it may point more often to prostate issues. Sometimes, the pain may be linked to completely different factors such as kidney stones, hormonal changes, or even reactions to medications. Because the range of possible causes is so broad, painful urination should never be ignored. Understanding what triggers it is the first step toward getting the right treatment and preventing long-term complications. In this video we will provide a detailed look at the many causes of painful urination, how they develop, what symptoms accompany them, and what can be done to treat and prevent them. To truly understand dysuria or painful urination, we need to first look at how the urinary system functions. Urine is produced by the kidneys as they filter waste products and excess water from the blood. It travels down two narrow tubes called ureters into the bladder, where it is stored until the bladder muscles contract to push it out through the urethra. This process is usually painless and efficient, unless something interferes with it. Painful urination arises when some part of this system, whether the bladder, urethra, or surrounding organs, is inflamed, irritated, or obstructed. The pain may be felt in different ways depending on the cause: a sharp burning sensation, a dull ache, or cramping pain during or after urination. In men, the discomfort may extend into the penis, scrotum, or lower abdomen, while women may feel it more in the bladder area or pelvis. It's also important to note that dysuria can appear in two forms. Internal dysuria occurs when the pain originates from inside the urinary tract itself, usually due to infections or stones. External dysuria, on the other hand, is caused by irritation or inflammation around the external genitalia, such as skin conditions, infections, or allergic reactions. This distinction helps doctors pinpoint the underlying cause more accurately. First, let's start with infections as a major cause. 1. Urinary tract infections, UTIs. By far the most common cause of painful urination, especially in women, is a urinary tract infection. A UTI occurs when bacteria, most often Escherichia coli, E. coli, enter the urethra and begin multiplying in the bladder. Because women have a shorter urethra than men, bacteria have a shorter distance to travel, making women more vulnerable. Symptoms typically include burning pain during urination, frequent urges to urinate even when the bladder is empty, cloudy or foul-smelling urine, and sometimes blood in the urine. If left untreated, UTIs can spread upward into the kidneys, leading to a much more serious condition known as pyelonephritis. Kidney infections bring additional symptoms such as fever, chills, flank pain, and nausea, and require immediate medical care. 2. Sexually transmitted infections, STIs. Another significant source of dysuria is sexually transmitted infections. Conditions such as chlamydia, gonorrhea, trichomoniasis, and genital herpes often cause painful urination as one of their early signs. In these cases, the discomfort usually results from inflammation of the urethra, urethritis, or surrounding tissues. STIs may also produce additional symptoms such as unusual discharge from the penis or vagina, sores or blisters, genital itching, and pelvic pain. Because STIs can sometimes be asymptomatic for long periods, people may not connect painful urination with an infection acquired through sexual activity. 3. Prostatitis. For men, Inflammation of the prostate gland, called prostatitis, is another frequent culprit behind dysuria. Prostatitis can be caused by bacterial infections, or it can occur without a clear infection in a condition known as chronic pelvic pain syndrome. Men with prostatitis may experience pain during urination, difficulty starting or maintaining a urine stream, pelvic pain, pain during ejaculation, and sometimes flu-like symptoms if an infection is present. 4. Vaginal infections. In women, infections of the vagina such as yeast infections or bacterial vaginosis can also cause painful urination. The pain in these cases often results from external irritation of the vulva rather than the urinary tract itself. Women may notice itching, abnormal discharge, or a foul odor along with the pain. Now let's look at the non-infectious causes of dysuria or painful urination. While infections are the most common triggers, not all cases of dysuria are linked to bacteria or viruses. Non-infectious conditions can also cause significant pain. 5. Kidney stones and bladder stones. Stones form when minerals in the urine crystallize and clump together. Small stones may pass unnoticed, but larger ones can lodge in the ureters or bladder, scraping and irritating the urinary tract as urine flows past. This irritation leads to sharp pain during urination, sometimes accompanied by visible blood in the urine. The pain can also radiate to the back or groin in waves, a hallmark sign of kidney stones. 6. Interstitial cystitis, or painful bladder syndrome. This chronic condition is characterized by bladder pain, urinary frequency, and urgency without any infection present. The exact cause remains unclear, but theories suggest that it may be linked to defects in the bladder lining, immune system dysfunction, or nerve hypersensitivity. People with interstitial cystitis often describe the pain as a constant ache that worsens as the bladder fills and improves after urination, though dysuria is a frequent complaint as well. 7. Enlarged prostate, or benign prostatic hyperplasia, BPH. In older men, benign enlargement of the prostate gland is a leading cause of urinary problems. As the prostate grows, it compresses the urethra and disrupts normal urine flow. Men may experience painful urination, a weak stream, dribbling, difficulty starting urination, and the sensation of incomplete bladder emptying. While not cancerous, BPH can severely affect quality of life if not managed properly. 8. Irritation from chemicals or medications. Sometimes dysuria arises from external irritants rather than disease. Harsh soaps, bubble baths, douches, or certain hygiene products can irritate the urethra and genital tissues. Medications, especially chemotherapy drugs and those that alter urine concentration, can also produce burning or painful sensations during urination. 9. Hormonal changes. For women, hormonal fluctuations during menopause can lead to thinning of the vaginal and urethral tissues, a condition known as atrophic vaginitis. With less estrogen, these tissues become more fragile and prone to irritation, causing pain during urination even in the absence of infection. Symptoms that accompany painful urination. Painful urination or dysuria rarely appears in isolation. Depending on the cause, it may be accompanied by other symptoms such as 1. Frequent urination in small amounts. 2. Urgent need to urinate. 3. Cloudy, dark, or foul-smelling urine. 4. Blood in urine, or hematuria. 5. Fever or chills if an infection spreads. 6. Pelvic or abdominal pain. 7. Unusual vaginal or penile discharge. 8. Painful ejaculation in men. The presence and combination of these symptoms give valuable clues to doctors about the underlying problem. Prevention of painful urination. Preventing dysuria requires addressing its underlying triggers. Good hygiene practices, such as wiping front to back for women, urinating after sexual intercourse, and avoiding harsh soaps, go a long way in reducing the risk of infections and irritation. Drinking plenty of water helps flush bacteria and dilute urine, making it less irritating. Safe sexual practices, including condom use and regular STI testing, are also crucial. For men with prostate problems, routine checkups ensure early detection and management. For postmenopausal women, discussing vaginal dryness and tissue changes with a healthcare provider can help prevent painful symptoms. Complications if painful urination is left untreated. Ignoring dysuria can lead to serious consequences. Untreated UTIs can progress to kidney infections, which may permanently damage the kidneys. STIs can lead to infertility, chronic pelvic pain, and higher risk of other infections. Chronic prostatitis can affect sexual health and overall quality of life, while untreated bladder stones can damage the urinary tract. Even non-infectious causes such as interstitial cystitis can lead to long-term pain, sleep disruption, and reduced quality of life if not properly managed. It's important to seek medical attention if painful urination lasts longer than a day or two, if it is accompanied by fever, back pain, blood in urine, or unusual discharge, or if it recurs frequently. Pregnant women, men with prostate issues, and anyone with a weakened immune system should be especially cautious. Early diagnosis and treatment prevent minor issues from becoming major health threats. Painful urination is a symptom with many faces, ranging from simple irritations to serious infections and chronic conditions. While it may sometimes be caused by temporary factors such as dehydration or minor irritation, persistent or severe dysuria is often a sign that medical attention is needed. Understanding the many possible causes, from infections like UTIs and STIs to non-infectious factors like kidney stones, prostate enlargement, and hormonal changes, can empower people to take their symptoms seriously and seek timely care. The key takeaway is that dysuria should never be ignored. By recognizing its causes, staying vigilant for accompanying symptoms, and pursuing preventive measures, you can protect not only your urinary health but also your overall well-being. Thanks for watching. If you found this video helpful, hit the like button, share it with a friend, and don't forget to subscribe for more health insights every week.